Hi, everyone. It's me, Fran Drescher, the founder of the Cancer Schmancer movement. And we are presenting you with Corona Care for You, a new series that is interviews with a assortment of amazingly brilliant, wonderful doctors who we believe in and align ourselves with because they're mavericks in the functional medical integrative world of medicine and reinventing the wheel and challenging the status quo and bringing us information that you may not find at your usual doctor if he doesn't happen to be a functional medical doctor. So I'd like to give a warm welcome right now to Dr. Frank Lipman. Dr. Lipman, how are you?
I'm good. How are you, Fran?
I'm great, and thank you so much for being here today. Let me just give our audience a little behind the scenes. You know, I found out Dr. Lipman got on my radar because um, I had become friends with a celebrity chef by the name of Seamus Mullen. And I had heard Seamus on television talking about how food became his medicine and changed his life. And he seemed very knowledgeable about many of the things that we at Cancer Schmancer talk about with our members all the time around the world. And so when I asked him, you know, what's his story, he said that he had a very severe rheumatoid arthritis, and all the traditional avenues of therapy, which was mostly to suppress his symptoms, were not helping him. And in fact, he felt like he was dying. So he walked away from all of that and found Dr. Lipman, who he attributes for absolutely saving his life. He had massive internal inflammation, and through food and nutrients and supplements, Dr. Lipman taught him how to live differently and completely changed his life and put all of his symptoms into remission. So I became very interested in this as well and interested in meeting the doctor. And so we're very lucky to have him here today. Now, Dr. Lipman, you're in New York, so you're basically on the right in the thick of it. And are any of your patients currently dealing with coronavirus?
Sure, a number are. And, I'm not in the front lines in terms of the crisis care in the hospital. So I'm not doing with the acutely ill patients, but many of my patients have had coronavirus. And what I've noticed, I mean, this is just anecdotal, but generally people who have looked after themselves, who are not in poor metabolic health, in other words, their sugar's well regulated, they sleep well, they move well, they look after themselves, all the things you probably talk about, those patients tend to have done better. The people who seem to have struggled more are the people who are either stressed out, weren't sleeping, whose diets weren't as good, and all these other factors, which make sense because it's not just the virus. The virus has to get into some host, into a person, and it's how that person responds to the virus. So it's a combination of many factors. But what I'm seeing, which is what I would expect, is many people have had it with being asymptomatic. The people who seem to have had the hardest times were people who generally weren't in good health to start with. That's a general statement, but for the most part, true.
Now, can you be more specific when you say people that were eating better and had a better diet versus people that were not eating as well? Can you be more specific about and differentiate the two in your opinion?
Sure, that's a good question. So what they found globally, actually, not just my experience, is people who have sugar dysregulation or have metabolic syndrome or have diabetes or pre-diabetes or obesity or hypertension. But the problem is usually downstream with sugar dysregulation, people eating too much sugar and junk food, which is triggering more inflammation. So these people, if you look at the numbers in New York, if you look at the numbers in Italy, all over in England, the people who've had the hardest time, the most deaths, have come from people who have been in what we call in poor metabolic health, who have not got good, who generally have probably been eating poorly for a long time, and over time that has caused these metabolic problems, obesity and diabetes and hypertension. So that seems to be the standard that we're seeing. So you not only have a pandemic of the virus, but you have a pandemic of chronic ill health, especially in the United States, but also in Europe and especially in England. But in the United States in particular, you have the pandemic of the virus converging with this pandemic of chronic ill health, which is usually related to the food industry and the crap that people are eating because it's cheap food that we get fed in America. You know, there's a wonderful Wendell Berry quote that I always use. You know, people are fed by the food industry that pays no attention to their health and treated by the health industry that pays no attention to their food. And I think this is making us realize how important the food we're eating is, not only to our own personal health, but to the health of the society in general.
Yeah, you know, I find it so interesting, the noticeable omission of this discussion on all the national news, which is mostly supported by big pharma advertising. So I do appreciate you talking about it, because we really have to, you know, have kind of a bottom-up groundswell discussion about how this is Americans' opportunity to start really looking at what is considered optimal health and what are we settling for by eating processed, nutrient poor, agrochemical, industrial farmed foods. It's very clear that that is not the way to eat if you want to be at an optimal and have your immune system as vibrant as possible, so that you can endure viruses as they present themselves. Would you say that's a correct statement?
100% correct. And I think we should even take it further. I think we can talk about the immune system, our personal immune system, but then there's the immune system of the earth and of the world. You know, we are microcosms of the macrocosm. The immune system of the world is broken, you know, from, you know, we have global warming, we're destroying natural habitats. This is why these viruses come. This is why more viruses are going to come. You know, factory farming, another problem, you know, concentrated animal factory farms, operations, CAFOs. These are all these underlying reasons why we are going to have to endure more and more of these pathogens and viruses. So we've got to get beyond even thinking of our own health and the health of the environment, because this is a chance. This is the time for us to address the food industry and the immune system of the world. So we need to address climate change and global warming, because it's all part of the same picture. And if we don't, you know, if we don't learn our lesson now, I don't know when we're going to learn our lesson.
Well, unfortunately, you know, there's so much greed that goes on amongst humans that they, you know, kind of turn a blind eye to the obvious. And even the fact that no matter what news you watch, no one is talking about the fact that poor diet is contributing to who gets hit the hardest with this coronavirus, let alone the fact that it's pretty widely believed that it began in a factory farm. So, you know, with highly stressed animals, what we are, what we eat. I mean, that's what you taught Seamus, and he learned how to completely change the way he lives and the way he eats. Do you think that eating organic is key to having a healthy, you know?
Sure. Well,
Immune system?
yeah, I think it's tricky because, people, the finances are an issue now, and organic is always a little bit more expensive. But yes, I do believe if you can afford it, organic is always better. There's no question. Knowing the source of your food is always better. So I try avoid factory farm meats or non, factory farm chickens or eggs. So I think knowing the source is really important, and the chemicals that are sprayed on our food are not helping. But these are tough times, and I think it's important. We need to be kind to ourselves and have self-compassion. If you can't get that, you can't get that. Yes, ideally we should be eating organic food. In the ideal world, it shouldn't even be called organic. That's what food just should be. The food that has all the pesticides and chemicals on should be labeled something else. That's it.
Poison.
Right. So, I mean, these are tough times. So yes, ideally we should be eating organic foods, but if you can't get them, don't come down on yourself. Being concerned and worried about that at this stage is probably making it worse.
Well, it's interesting that you say that because I want to talk about the mental health of the patients a little bit too, because I know that you have a very definite point of view on the mindset of the patient.
Yeah, I think we all, to a certain extent, are going to have post-traumatic stress syndrome. So we're all going to have to deal with the anxiety and the fear. I'm a big believer in meditation. As meditation changed my life. I encourage most of my patients to meditate or do something to calm the mind. We all so used to being very busy and caught up in our thoughts. So learning something to get out of your head is really important. For some people, meditation is tough. So I recommend something like yoga or some moving meditation first to teach you how to get out of your head. Some people, it's exercise. But I think it's important to learn to get out of your head and then learn techniques to actually calm down the nervous system and deal with the anxiety, because there's so much you can do about the stress. There's nothing we can do about all the stress out there, but how we respond to it is something we can change. So I think it's crucial in this day and age now to learn some techniques, whether it's meditation or breathing or yoga, whatever it is, listening to music, whatever it is that works for you. I think it's really important to start creating these habits of learning to relax and calm down the nervous system.
It's interesting. People don't realize that trying to balance mind, body, and spirit is in itself a daily practice. Every single day, you have to be mindful of it, and you have to try and find the experiences that help you to keep that balance in place so that you can, so that your body can function at an optimal. And it's very hard to do that if you're stressing or you're locked in your head. I mean, when you say, you got to get out of your head, I guess that's part of what meditation helps you to do, is even become aware of the fact that you're in your head.
Sure.
We have to become mindful that we're in our head. Deepak Chopra once said, which I find very helpful, and I do sometimes, when you're really caught up in some old conversation or argument, or you're just ruminating about something in your head, you're not really present, you're not in the moment, you're in your head. And if you are fortunate enough to become aware that you've been lost in your thoughts for a while, take something that is in the room around you, no matter how mundane, something that you never even focus on because it's just always there, and look at it with wide-eyed wonder.
Right.
And when you do that, you're kind of pulled into the moment.
Right.
And out of your head.
So that's a great tip, because he's taking that Vedic meditation concept of a mantra or a focused to focus your concentration on one thing, whether it's a mantra or an object, and he's making it practical for us Westerners. So I like that. I think there are many techniques that I've learned from the East that are very helpful in this day and age, because I think we need to realize this is a new normal. We have to realize life is going to be different, and we don't want to go back to the old way. So the new normal to me is being more centered, more connected to who you are, more present, not just rushing, spending time with your family, spending time with yourself, spending time in nature, being more connected, I think is going to have to be the new normal, because that is what's going to help us help modulate our immune systems better, so it doesn't underreact or overreact. So I think all these basic tenets of so many of these old traditions are more and more important now.
So, did the patients that are part of your practice that did get corona, being in New York, were they more mild cases generally because they take your supplements and follow your recommendations for diet?
I believe so. I mean, I've had a couple of emails saying I had it, my husband had it, my husband had a much harder time. He's overweight, he eats and drinks too much. So it's been a wake-up call for them. So yes, as a general rule, that has been my experience. This is just from patients emailing me and me speaking to lots and lots of people, that the people who tend to have been healthier to start off with tended to have a much easier time with the
Well,
virus.
it certainly is an incentive to try and get healthy, especially while we're home anyway, to think about and look at all the things that we surround ourselves with that are carcinogenic and toxin, constantly eroding the quality of your health. And then the foods that we eat, are they processed? Do they have corn syrup sweeteners? Are they GMO? Do they have all kinds of pesticides and herbicides and hormones and antibiotics? These are all the things
Right.
that erode our health. And when push comes to shove, you're not going to be in fighting shape for the next eventuality. And, at the end of the day, we're the consumers that drive all the insanity. Manufacturers don't want to kill us, they want to sell us. But they'll sell us anything that we're willing to buy, which right now is anything. I say that all the time. And so, if we can use our purchasing power to buy things that are clean and local and organic, we'll be doing ourselves and our families and our pets and the planet a big favor, because we are all interconnected. Now, Dr. Lipman, you're a believer in supplements, and you have a line of your own that you offer your patients through your practice. What would you say is the most key supplements that you would recommend to your patients during this time?
Sure. First of all, I don't have a line of my own anymore. I let that go a while ago. But I'm a still believer, a huge believer in supplements, because I think supplement, as the word says, supplement a good diet. So as much as supplements get a bad rap in the media with traditional doctors, I think targeted supplementation is very helpful. Now, everyone's different. We all, same as we look different on the outside, we're different on the inside. I don't think there's standard supplements everyone should take, but targeted supplementation is extremely helpful. Seamus is a perfect example. We gave him very targeted supplements for him to reverse his rheumatoid arthritis. I think there are a number of generic supplements now that I think are helpful, because they dampen the inflammation, they can decrease the viral load, they can actually help you cope better with the virus. So I don't think they necessarily boost your immune system, but they help modulate your immune system. They prime your immune system so you don't overreact. A lot of the people getting sick have had this, what they call a cytokine storm. That's too many inflammatory particles getting released, and especially in the lungs, and they get, acute respiratory distress syndrome. So you want supplements that can help modulate your immune system. And the ones that I have been recommending for the most part now are quercetin, which most people don't know enough about, which I think is wonderful because it helps modulate the immune system. It can help dampen down the inflammation. Curcumin can be very helpful. NAC, N-acetylcysteine, which is an amino acid and a precursor to glutathione, can be helpful. Vitamin D, I think, is essential. There have been studies coming out showing that people with lower vitamin Ds don't seem to be doing as well. So having a good level of vitamin D, that's something can be checked by your doctor, is important. So
What
those
about zinc
yeah,
and vitamin C?
zinc is one of those nutrients that seem to help with viral infections. So zinc's another one. Vitamin C can be helpful. So there are many. I mean, people don't want to take a lot of supplements. I understand. I mean, for the first time in a long time, I'm taking my supplements every day. But I do feel supplements and make a big difference, especially in a time like this when you want to modulate your immune system. And the other things that, things that you don't have to buy. Sleep is key for your immunity. We take sleep for granted. We think nothing happens during sleep. Sleep is actually when your body repairs. It's when your immune system rebalances itself. It's when your brain actually, there's something called the glymphatic system in the brain, which cleans out all those toxins that build up during the day. So your sleep is key to your immune system
Well,
functioning.
what do you think about taking melatonin? Is that okay?
Well, melatonin is interesting because a low dose melatonin can help with sleep, but some people use a higher dose melatonin, 5 to 10 milligrams, as an immune modulator. So there are people using high doses of melatonin actually for immune modulation and priming the immune system. But if you want melatonin for sleep, you don't need to take as much. Half a milligram to 1 milligram is usually more than enough for sleep. But sleep, you can just getting outside early in the morning, first thing in the day, is really important for sleep. Sleep, you got to see what you're doing during the day more than what you're doing at night.
Does that have to do with the circadian rhythm?
Exactly. It's all about rhythms. To me, sleep is your primary rhythm. So what you do during the day, you need to get natural light during the day, not sit under artificial lights all day. And then you sit under artificial lights at night, because if you do that, then your body still thinks it's daytime. So it doesn't start producing the melatonin. So you need to start thinking of your body as just part of the natural world.
Well, I've got this new rescue dog here, and she gets me up at like 6 a.m. She wants me to take her out. We took a nice beach walk this morning, way before 7.
Good. That's the best time. So you go to bed earlier. I do the same thing with my dog. I get up early with her and go play with her. But I have a new grandson.
Oh, congratulations.
So we up early anyways. That's good. So I go to bed earlier now. It's great. And I get up earlier. It's wonderful.
Oh, so are you all living together?
Yeah. Yeah.
Oh, you're lucky, because some of my friends who are new grandparents, they're so frustrated that they can't see the children.
I know, I'm very lucky. I'm blessed. Yeah.
Oh, it's beautiful. Well, Dr. Lipman, is there anything else that you would like to add before we wrap this up?
No, I think it's a time now for everyone to start taking charge of their health, to paying attention to their own health, to paying attention to what's going on in the world, our food system, as you so correctly pointed out. Purchasing your food. We, the consumer, are the only way the food system is going to change. We need to only support suppliers that are sourcing their foods well and not putting chemicals and toxins into the food. So I think being aware of the food system, being aware of our economy, our government. It shouldn't be about us against them. We need to see the big picture. It's all affecting our health. And ultimately, climate change and global warming is a huge issue. So I think we need to be aware of all the immune system of our bodies, the immune system, the economic immune system, the political immune system, the world's immune system. They're all really weak at the moment. We all need to pay attention to all of this, build it all up. So that's what I'd like to say. And, we need to realize this is a new world. Same as I'm not going to be going into my office as much anymore because there's telemedicine. So I need to adapt. We're all going to have to adapt to a new world, to this new way of living. Some people it's easier than other people, but we need to also realize we're all in this together. We can't ignore our fellow human beings. We can't ignore people from overseas. This is a global pandemic. We're all in this together. And I think realizing the connectivity of the world now is also really important.
I cannot thank you enough for taking time out of your day to talk to us and help our viewers all over the world. Once again, hear your wisdom of how to stay well, how to change your life. And if you want to contact Dr. Lipman, just go to drfranklipman.com and you'll find out all about his 1111 Wellness Center in New York and everything that he's about, and he's a great man. So we thank Dr. Lipman, and we thank all of you for tuning in, and we wish you good health and long life. Peace. Hi everyone, it's me, Fran Drescher. Well, I hope you enjoyed Corona Care for You, and if you did, please think about making a donation to us at cancerschmancer.org/donate. Like so many nonprofits, we've had to cancel all of our fundraising events. So it's really up to you to help keep us going. We depend on your donations, your support, and your love. There is no donation that's too small, and we are grateful to anything that you feel comfortable giving. And continue to come in to the Cancer Schmancer Corona Care for You series, because we are constantly posting new content, and we hope that it's helpful to you and your family. Don't forget to donate. We really appreciate your support. Thank you.